LSD, the euphoric drug. LSD is one of the most widely recognized hallucinogens, known for its ability to induce powerful altered states of consciousness, vivid visual hallucinations, and profound shifts in perception. It has played a significant role in both countercultural movements and scientific research into consciousness. Now looking at the history of LSD. In 1938, Swiss chemist Albert Hofmann at the pharmaceutical company Sandoz was first to synthesize LSD. Hofmann was initially researching ergot, a fungus that grows on rye, which had been used for its historical medicinal properties, such as inducing labor. The compound LSD itself was largely overlooked for several years until 1943, when Hofmann accidentally ingested a small amount of the substance and experienced its powerful psychoactive effects. This event is considered the first LSD trip. LSD gained widespread popularity in the 1950s and 1960s, after it was adopted by various researchers and psychologists to study the mind and consciousness. It was used in clinical setting for psychotherapy and to treat addiction. In the 1960s, LSD became a key part of the countercultural movement, especially within the United States. However, due to its increasing recreational use and concern about its safeties, LSD was made illegal in the United States in 1965 and later classified as a Schedule I controlled substance in 1970 under the Controlled Substance Act, meaning it was deemed to have a high potential for abuse and no accepted medical use at the time. Despite its legal status, interest in the therapeutic potential of LSD has been renewed recent decades with studies focusing on its possible use for mental health treatment, addiction, and even enhancing creativity and problem solving. How is LSD used? Well, there's 4 different forms that it can be seen in: liquid, blotter paper, tablets, and capsules. LSD is typically found in liquid form or as blotter paper. It can also be found as tablets, capsules, or in gel form. The most common form for recreational use is blotter paper, which is often in tiny squares. The oral ingestion is the most common method of use. A person typically places the blotter paper on their tongue or swallows it. Now, when looking at the dosage, it is usually around 100 to 200 mcgs, which is also called micrograms. When we look at the duration, the effect of LSD usually lasts 8 to 12 hours, with the peak experience being between 2 and 5 hours. Now, we look at the immediate and physical effects of LSD. First, we look at perceptual changes. Colors may seem brighter, sounds may be more vivid, and shapes may appear distorted or exaggerated. Hallucinations can occur, including seeing patterns, objects morphing, or even entirely new visual phenomena. Emotional fluctuations can happen, where users may experience intense feelings of euphoria or profound insight. On the flip side, feelings of anxiety or paranoia can also arise. Lastly, we look at time distortion. Time may feel as if it's stretching or shrinking. Minutes can feel like hours or vice versa. Next, we look at the physical effects. Pupillary dilations can happen, which makes the eyes appear larger. There can also be increased heart rate and elevated blood pressure in the person taking LSD. The person taking LSD can also experience sweating, chills, and sometimes nausea. Now, finally, looking at the psychological effects, the effects of LSD are often described as mind expanding. Users may feel an overwhelming sense of connection to the universe or others. Some people report a loss of ego, also known as ego dissolution, where the boundaries between self and environment blur. Now we look at bad trips and the after effects of LSD. Bad trips. Not all experiences with LSD are pleasant. A bad trip can involve overwhelming feelings of fear, paranoia, and confusion. These experiences can be psychologically disturbing, sometimes leading to lasting anxiety or traumatic memories. Now we look at the after effects. After the acute effects wear off, users may feel fatigue, mental exhaustion, or a sense of clarity and insight. The come down can be gradual, but some users report lingering effects like mild visual disturbances for days after taking LSD. There are a lot of risks with taking LSD, like psychological distress, and it's not suitable for those with mental health conditions like schizophrenia. Now we look at the medical use of LSD. Back in the 1950s and 1960s, LSD was used in psychotherapy to treat conditions like depression, anxiety, addiction, and post-traumatic stress disorder, known as PTSD. Some studies suggested that LSD could help patients access repressed memories or facilitate deep introspection, which could aid in the healing process. Now we look at the recent studies. In the 2000s and beyond, there has been a resurgence of interest in therapeutic potential of LSD, particularly for mental health. Modern clinical trials are investigating its use as a treatment for depression, anxiety disorder, addiction, and even cluster headaches. Now we look at the ongoing trials, and they're investigating LSD in conjunction with therapy for deeper psychological healing. Meaning, the main reason that scientists are looking at LSD nowadays is for that mental health, like for mental health in a person. LSD is a powerful hallucinogen with a rich history in both recreational use and scientific research. While it has gained a reputation for its role in the 1960s, it is also showing promise in modern therapeutic contexts, particularly in the treatment of anxiety, depression, and addiction. As research continues, it is possible that we may see a resurgence in its medical use, provided it is administered in a safe and controlled manner. Whether it will be fully integrated into mainstream medicine or remain a niche treatment is yet to be seen, but LSD's ability to profoundly alter human perception and consciousness will likely continue to captivate scientists, clinicians, and users alike for years to come.